Multiple indicator cluster survey mix is a document that will actually contribute to the government's report on the Millennium Development Goal, and it will feed into the Secretary General's report of the Millennium Development Goal. It covered more than 17,000 households across the country, both urban and rural area. Look at the trend on maternal mortality in the country. For the first time in the past, say, 24 years or so, we see that a change in the trend. This talks about the policies, the programs, and the system coming back in place. On water and sanitation, 76% they have access to safe drinking water, and 34% of the population do not have access to clean water. Improved sanitation is the reason why the country has not witnessed the outbreak at the scale that we had in 2008-2009, the cholera outbreak. On education, there has been some, but not much, improvement because you had a very solid base for primary education anyway throughout the 80s, 90s, and 2000. Birth registration for a country with the systems that is in place, like Zimbabwe, having a low level of birth registration is worrying, it's of concern. What does the mixed data tell us? Clearly, it demonstrates the resiliency of the social sector. Sustaining and building on the gains needs a special attention, and we have to keep the focus on.
All this effort of success has come out of a good partnership between the government, donor, UN, and other organizations. So we need to not forget that and really capitalize on that learning.
I think for us in the health sector, we're very proud to see this progress in the last 4 or 5 years.
Let's put resources, human, financial resources on the table, and let's have an open dialogue on the challenges and how to solve the challenges.
As long as you're giving these results, I feel very strongly that message of sustaining needs to really be hammered. Otherwise, we find ourselves back in the intensive care